Shall I? Good morning, everybody. I'm Dr. Pradeep Kumar, Interventional Cardiologist at Aster CMI Bangalore. In these times, now most of our minds, and including the government, hospital administration, everybody put together, their entire focus is on COVID. So when I've been asked to speak about heart attacks, it looks like, it's something people may feel is not relevant at this time. But, from a medical perspective, what we are seeing is a lot of patients now with other medical conditions, like other than COVID, or people who have coexisting conditions, especially heart-related conditions, cancers, some acute abdominal problems, acute surgical emergencies. Many of these patients are not getting treated and are not, reaching the hospital. So heart attack as such is a word that, gets people scared. And it usually is associated with death, premature death, and a lot of morbidity. So to bust the myths, as well as what are the preventive measures, because in any disease, if it is preventive, that is the best way to do it. So you prevent the disease and then you needn't worry. Because once the disease sets in, then we have to treat it and then look at the follow-up and chances of recurrence of events. And these are the issues that usually come in. Now, when we talk about heart attack, many a times people, don't know what a heart attack is. So a heart attack is a condition when the blood supply to the heart. See, the function of the heart is to pump blood to the rest of the body. So it receives blood which does not have oxygen, pumps the blood to the lungs where it gets oxygenated, and then that comes back to the left side of the heart and pumps oxygenated or blood that has oxygen to the rest of the body. So this pumping mechanism is very important. It provides blood to the rest of the body with nutrients and, most importantly, oxygen. So to do that, the heart itself requires oxygen. So when a patient, when a person has a blockage to this blood supply, a heart attack happens. Usually, if the block happens suddenly, and most of the times it is due to what we call a thrombotic event, where there is a blood clot within the blood vessel. So, this is a simple. Can you just focus this, Shane? This a simple representation of the blood vessel. So it's like a tube. This is a cross-sectional view. So as time goes by, this accumulation of fat in this place is called a plaque. So it starts encroaching on the blood supply to the heart. It starts narrowing the vessel lumen or the tube inside. And in some people, this plaque, which got a covering, it's called an endothelium. When that ruptures, there is blood clotting. So when there is a clotting inside a block, that is when somebody has a heart attack. So many a times people have this doubt. Now somebody said, I had a minor attack, I have a major attack. So what is the difference? So basically, medically speaking, there is nothing called a major or a minor attack. So the simple thing is, if a patient has a large area that is not receiving blood supply. So there are three major arteries in the heart, which is called the LAD, the left circumflex, and the right coronary artery. So any vessel that gets a blockage right at the beginning, before any branches. So these patients will have a larger area involved, and they have a more symptoms, more chance of having mortality and further events. One, the heart may become weak. Two, there may be some valvular involvement, leakage of the valves within. So these are the problems that can happen with a heart attack. So most of the patients, first thing they would like to know is a heart attack a preventable disease? The answer is, to a large extent, yes. The reason is, this is a lifestyle disease. This is because of our altered lifestyle, westernized lifestyle, reduced physical activity, Western type of diet, These are the causes, and of course there are a lot of other non-modifiable risk factors as well. So like when somebody says, I had a heart attack, I didn't have any problem, I did not have diabetes, I did not have hypertension, I wasn't a smoker. So it doesn't mean, it is not a guarantee. These are all risk factors. There are what is called modifiable risk factors and non-modifiable risk factors. So when we look at non-modifiable risk factors, so these are something that we cannot change, but still gives us an increased risk of a heart attack or blockages in the blood supply. So what are these non-modifiable risk factors? The simple first thing is age. As somebody grows older, chances of developing these blocks are there. So many a times there may be a patient without any risk factor except the fact that he is old. So older the patient, higher the chance that these blocks can develop. Studies have shown that these blocks start even in adolescent life and even in the 20s. So that is even post-mortem trials have shown that these kind of fatty streaks in the blood vessels start at a very young age. So as age advances, these things progress, and then there can be a heart attack later in life. So the first non-modifiable risk factor is age. Second most important thing is sex. So a woman who's a premenopausal woman has a very low likelihood of developing blocks and heart attacks. The reason is that the hormones during the premenopausal stage have a protective effect and the formation of plaques is very rare in ladies who are in the premenopausal age group. One of the common reasons is if a lady smokes or if she's diabetic, then that protective effect of the menstruation is lost. Otherwise, generally females in the premenopausal age are protected. Now, one more very important non-modifiable risk factor is ethnicity. So when you take a South Asian, like an Indian or a Sri Lankan, and you take a Caucasian, there is a definite difference in ethnicity. So the chances of Indian developing heart attack or blockages in the blood supply is almost 5 to 6 times higher than a Caucasian. So the thing is, Indians develop blockages at a lower, age, that is in their 40s and 50s as compared to 60s and 70s in Caucasians, and it is even lesser in Japanese and Chinese, and even less when you compare Africans as compared to Indians. So as an ethnic group, which we can't alter, we are at a much higher risk than other ethnicities. And even between North Indians and South Indians, there is a difference. That North Indians are less prone than South Indians. Again, it may be due to genetic factors. So these are the common non-modifiable risk factors. So you can't change your age, you can't change your sex, you can't change your ethnicity. So these things we will not consider too much. Only thing that an elderly person should be more careful. A man should be more careful than a woman, and an Indian probably should be more careful than others. So what are the modifiable risk factors? So this is what the entire whatever talk I am giving now, it should be focused on this aspect, like what are the modifiable risk factors. Most important for a young crowd, the single most important thing is smoking. A smoker has a 3 to 5 times increase, that is a 300 to 500% increased risk of a coronary event as compared to a person who is a non-smoker. So smoking is a very, very important thing. And second thing is diabetes. So again, if you are not diabetic, your risk of developing a heart problem is around 3 to 5 times lesser than a patient who is non-diabetic. So a patient who's got diabetes is almost equivalent to a patient who already has diabetes. Who already has a heart problem, was already diagnosed to have blockages in the blood vessels. So a person who is diabetic is at a much higher risk. What are the other risk factors? Another very important risk factor is blood pressure. So blood pressure is very, very important because many a times it goes unnoticed. Patients do not know that they have blood pressure. Many people don't even measure their blood pressures late into their 40s and 50s. So such a person would have a high attributable risk. So blood pressure will increase the chance of blockages not only in the blood supply to the heart, it can cause kidney problems, it can cause eye related problems, it can cause stroke, it can cause something called dissection. So knowing your blood pressure and getting it treated is very important. What are the fourth most important modifiable risk factor is cholesterol. So many people get only a total cholesterol done, but then in cholesterol, in plasma cholesterol, there is multiple fractions that are seen. So the low density lipoprotein cholesterol or LDL cholesterol is the most important. So if that is high, usually more than 130 milligrams per deciliter, and some guidelines say even more than 100 milligrams per deciliter is abnormal. So anything above that, we have to treat it. The simple ways to treat cholesterol, high cholesterol, is to modify your diet, modify your physical activity, and if the risk factors are high or if the cholesterol is very high, then we have to take medications which are called statins and which are reasonably safe and reduce the cholesterol levels and have known to reduce cardiac events. So again, cholesterol levels have to be checked in patients who are in their adolescence itself. So anybody should have their cholesterol levels checked at 10 years, and every 5 years it has to be checked. If it is normal, nothing needs to be done. If it is abnormal, then it has to be treated. So if a cholesterol level is normal, when do you recheck? It is usually around 5 years. And in the cholesterol, the HDL cholesterol and triglycerides also are a risk factor. So if triglycerides are high and HDL or the protective cholesterol, high density lipoprotein cholesterol, is low, then it is a marker for development of further disease. So it is also possible that a patient may not have very high LDLs, which is seen in Indians and diabetics, but have low HDL or low high density lipoprotein and high triglycerides, which can again lead to heart attacks and blockages in the blood supply. So other things are diet. Again, a diet that is rich in refined food, high in carbohydrates, high in fat, high in saturated fats, high in trans fats. So all these food products invariably lead to accumulation of fat in the blood vessel. What else? The other most important thing that many of us find excuses not to do is physical exercise. Because of modernization, most of our day-to-day activities is done with minimal effort. So what needs to be done is, you have to be physically active, which is moderate intensity activity of around 45 minutes. And there are a lot of newer markers for coronary artery disease. Again, for a general population, these things cannot be recommended, but then again it can, if a patient has a very strong family history of heart attack, a lot of people have died at a young age. In these kind of patients, other things like lipoprotein A and fibrinogen levels and even sometimes the CT coronary angiogram can be done to see whether they are at risk of developing heart problems. So now I'll just go and take some of the commonly asked questions. So let us look at some of the commonly asked questions that people ask. What are the preventive measures to avoid heart attacks? So preventive measures, like I told you, modifiable risk factors, we really can't change much. The non-modifiable risk factors, one, everybody should have their blood sugars checked, they should have their blood pressure checked, they should have their cholesterol levels checked. And if these are abnormal, then they should take the advice of a physician and then treat appropriately so that these levels, good control of blood pressure, good control of diabetes and optimal cholesterol levels will prevent occurrence or prevent progression of this disease. What else can you do? Very important is to have a prudent diet. Try and eat small meals, eat frequently, eat lots of fruits and vegetables. As a general rule, dairy products, bakery products, which are rich in fat, which have trans fats, these are the products that have to be avoided. Meat eating, again, if it is lean meat and if it is taken in moderation, it is not bad. If you are taking red meat, which you're taking more of fat, then it has to be occasional, and if at all you are taking this, it has to be associated with significant exercise and it should not be taken in large quantities. So I've already spoken about the risk factors. There are many people who come to us. So what are the dietary changes that have to be made? So these are the simple things. Now if you actually go to a dietitian and get a diet plan, probably it may be difficult to follow. But as a general rule, do not binge on any food product. Most of us have a sweet tooth. We eat a lot of sweets, or sometimes we eat a lot of fried food. We eat a lot of processed food, a lot of salt. So these are the things. Home cooked food generally is healthy if you're not putting in too much of oil. And again, deep frying it, repeatedly frying it, using hydrogenated oils. So these are, fats, dalda, these kind of things should not be used. Vanaspati and things like these are very high risk for developing. Again, reheating oils. Many a times you see in the roadside stores that they are heating oil, again reheating. So these are not healthy at all. So the other thing is, do all heart attacks have the same symptom? Now this is very important because patients sit over heart attacks thinking it's acidity. So even sometimes when I myself have some chest pain, I have a doubt whether it's a heart attack or not. So it's very difficult for us to say whether it is a heart attack or not. So what is the symptom? The most common symptom of a heart attack is chest pain. So many people have chest pain which is right at the middle, and is usually described as a pressure or a weight. But some people experiences it as burning. Some people have different kinds of experiences, like they have only arm pain, some people have only back pain, some people have only jaw pain, which is very, very specific. So when somebody tries and walks or does something wherein the heart rate increases, or eats and walks, so when these things happen and there is chest pain, and if you take rest, if it comes down within 5 to 10 minutes, it is called angina. So this is the typical symptom of heart blocks. This happens when there is a block like this of around 80-90%, then patients will have symptoms only on exertion. Now when that same symptom happens at rest, then we have to suspect a heart attack. Now, will all patients have the same symptoms? No. Many a times there are certain diabetics, certain elderly patients, certain hypertensive patients who have had a heart attack but would have never experienced it. They have never gone through a doctor or get it diagnosed, but eventually when they come back on follow, we say that they've already had a heart attack. So there is something called a silent heart attack, and that entity may be around 10 to 20% of all heart attacks may not have any symptoms. So that is a variability that is seen. In some patients, they do not get chest pain, they get breathlessness. So once the heart attack happens and the heart is weak, they become more breathless. So that is one more symptom. Some people have loss of consciousness. So there was one patient who came to us who had fallen down 8 times, 9 times because he had what is called an inferior wall MI, his heart rate has reduced, but he never complained of chest pain. So again, that is a presentation. Some people have only sweating, some people have back pain. So all of these can also be a symptom of heart attack, but the most common one still remains chest pain. So, when many people ask me this question, now once I have a heart attack, what first aid should I do? Should I take medications? Should I take aspirin? Should I take some other tablet? Or now when we see movies, we have these magic pills, the guy gets pain, he puts something under his, in his mouth and he becomes okay. Usually those are the nitrates or sorbitrate. That can work only in patients with stable angina or unstable angina, where there is the blood vessel dilates a little and patient becomes better with sublingual sorbitrate. So from my experience, it is very difficult for one to diagnose a heart attack based only on symptoms. So the most important thing, if you are staying in any place, you should always have certain things in mind, like just You want to look at your kids' school, you want to look how far it is away from your office. So many of these things that we look at. We should also know which hospital we should go to when we have an emergency. So we should go to an hospital where a simple electrocardiogram or an ECG can be done and interpreted. Many a times you go to a small hospital, ECG is done, nobody can read it. So it's very important that you go to a hospital, get an ECG done. Even now, despite all the advances in the medical field, the simple thing is ECG is something that can be done easily and interpreted easily. So if somebody has chest pain, any doubts, go to a hospital immediately. Don't wait. There have been, there's been my own relative who had chest pain at night, got up, told his wife. Wife said, okay, you wait, but, developed cardiac arrest in the morning, couldn't reach the hospital. So this can be potentially dangerous. In a heart attack, 25 to 50% of deaths happen with the first hour. So the first hour is the golden hour, so it is very important that we have to go to the hospital immediately, get ourselves tested, at least a simple ECG to rule out a heart attack. So that is very important. So there are some questions that I've got. One is heart disease hereditary? Yes, it is hereditary. If the parent has heart attack or has diagnosed to have coronary artery disease or atherosclerosis, chances of that coming to the child or sometimes even within siblings is quite high. So somebody with a strong family history of heart disease definitely should be more careful, should look at all these parameters that I've already told you, like blood sugar, blood pressure, cholesterol levels, have a very active lifestyle, should definitely not smoke, and also get tested if the family history is very strong. So heredity does play a very important role when it comes to heart attacks. So can exercise really make your heart strong? Now, the heart doesn't have to become stronger than what it is. The heart is actually a very strong organ. It keeps on pumping. It can pump non-stop for 90 years, 100 years. So it's not about the strength of the heart. It is more about the heart being in the right size, able to contract normally and relax normally. And more importantly, the valves and other regions should be normal. The simple thing is to prevent development of blockages in the blood supply to the heart, or what we call atherosclerosis, something like this. As you go on, there is accumulation of fat. To prevent that, heart attacks, exercise is a very good way to do it. Exercise has a lot of effects. The loading condition of the heart increases, improves. The oxidative stress of the heart reduces, chances of developing blockages gets reduced. There are many, it's very difficult to look at the effect of exercise over a long period, but still it has been done. And even something like a simple fast cycling for 7 minutes, 3 times a week, has shown to reduce chances of heart disease as compared to a person who does not do it. So physical activity is very, very important. So does it help? It absolutely does. Now many people tell me, somebody is in their 60s, they tell me, how fast should I walk? Is it enough to walk slowly? If you walk very slowly, it is always better than sitting. Sitting is better than lying down. So it depends on each person. What is considered moderate intensive activity is you walk for 45 minutes at around 5 to 6 kilometers per hour. Even if you're walking around 3.5 to 4 kilometers, it's a good level of exercise. How many days should you exercise? Initially it was said 5 times a week. Now they say all times a week. So if you are able to do it every day, good. At least if you want to take a break, take 1 day's break. Is jogging better than walking? Definitely yes. It gives you more, a person who's fitter can jog, a person who's fitter can, run. So it's, irrespective of what happens to the knees, that again is controversial. If you're able to jog, it is better. If you're able to run faster, it's even better. But if you're unable to do any of this, even 45 minutes of simple activity is good enough. So there are some more questions. Now, in our practice, what we see is a lot of patients come to us. Many of them do not have heart problems. So, like, there are patients who come to us with pain, pricking kind of pain, only one side pain, shoulder pain, constant pain. So these are all not typical. What I told you, like, what is typical angina is you get pain here. You may get it at other places, but if you have difficulty in performing any task, like say walking fast or climbing stairs, then definitely you need to get your heart checked. Now, other than, tests that are there, we also have to look at what is the treatment for heart attack. Now we know what is what are the risk factors of heart attack. Since I'm running short of time, I'll just quickly run through this. When a patient develops chest pain, from the time he develops chest pain to the time he goes to the hospital, in the West, they've reduced that time to around 2 to 3 hours. In India, 2 large trials showed that we go to the hospital at around 6 hours after onset of pain. The patient reaches the hospital 6 hours after. And only 5% go in an ambulance. 95% either use their own, mode of conveyance, or they go by public transport. There are people who go with a heart attack in a bus. They go to in a public bus, they go in an auto rickshaw. So that should not be. Whenever there is a doubt, you go to the closest hospital or you call for an ambulance, because time is of essence. People can die in that period. The first 2 hours are very crucial. So whenever somebody gets severe chest pain, please go to a hospital, get an ECG done, stay there for another hour, repeat ECG, or something called a troponin test is there, which is a test that looks at any damage to the heart. It will, even if the ECG does not pick it up, a troponin test can pick it up. And the second thing, now once a patient develops chest pain, he has to reach the hospital quickly. So in the hospital, now many people tell me, like, oh, I went there, I just had some pricking pain, patient came, we went to a hospital and we don't even know what happened, doctor urgently did some angiogram, angioplasty. So the problem with a heart attack is time is muscle. The earlier you treat it, the better. If your heart gets damaged, then you go into something called a heart failure. So we don't want somebody to reach that stage. A patient should be alive and his heart muscle should be good so that future also he does not have a problem. So it is very important you go early, and if a doctor diagnoses, this is a very common problem. They want multiple opinions. People, generally are a little, this mistrust between the doctor and the patient is so high that most patients nowadays want a second opinion, third opinion, but not in a heart attack. Please don't do these, shopping in a heart attack, because it's an emergency. You can't keep going from place to place. Your muscle is getting damaged. If you come with a heart attack today and I treat you tomorrow, it's as good as not treating you. Because doing an angioplasty to a vessel that is closed for 24 hours is of no use. All trials have shown that. So it's very important to, go to a hospital you trust, go to a doctor you trust, get an ECG, at best get an opinion on the ECG, because nobody is, probably, I don't know, most doctors I think should be honest enough to diagnose a heart attack properly and treat it properly, because this mistrust that is there in the mind really creates a lot of problem to the patients. Now, in a normal, uncomplicated heart attack, the chances of death in the first 7 days is around 12% if you do not do anything. So if I have a heart attack and I don't treat it at all, and if it's not a main, heart attack that is complicated, I will still survive that. 88% of the time, nothing will happen to me. Unless I go into cardiogenic shock and there is another setup where your chances of death may be as high as 60% and sometimes as high as 90%. So, not all heart attacks are fatal. So, just because you survive a heart attack does not mean that one doctor gave you a wrong diagnosis or whatever it is. So, it is important to trust your doctor, go to whoever you are. When you have chest pain, please listen to what that man has to say. Like if he says angioplasty, there are 2 ways to treat an acute heart attack. One is to do what is called an angiogram and open up the vessel under direct vision, which is called an angioplasty, which is the gold standard. That is the preferred method of treating a patient if it can be done within the first 2 hours of you going and meeting a doctor first. So wherever you go to a doctor, whether there is a cath lab or not, from that time to the time you reach another hospital or wherever on the same hospital, angioplasty can be done within 2 hours, then it is the best choice for treatment. The second option is something called thrombolysis, where it's a clot busting medication is given. Clot can be dissolved and patient, the blood flow is restored. Subsequently, he'll again require an angiogram, but at least as an emergency, if there are problems with logistics, if cath lab is not available, doctor is not available, patient doesn't have the finances, he wants to get it treated, please get at least a clot busting medication. Every procedure has its complications, but chances of bleeding, chances of having a repeat heart attack, chances of developing complications during the procedure are there, but it is better to get it done than to leave it like that, because patients can die in the next few days, and also patients can have what is called heart failure. It is very difficult for a patient with severe chest pain to with a weak heart, they are unable to lie down, they get swollen, they can't walk even a little bit. So it is not at all a good condition to have. So whenever a patient in a heart attack, treatment is an emergency. So patient has to get treated as early as possible. Any other questions? Thank you. If there are any other doubts, you can put it up on the thing on Facebook, and we will be happy to respond through Facebook. Thank you.